So welcome back. Today we will be talking about asthma. And we know that it is a very ancient disease because it was first described by the Egyptians around 3000 BC. And we know that our friend Hippocrates described it in detail actually around 450 BC. Actually, the word asthma comes from Greek meaning to pant. Asthma is when the lungs overreact to something that is already in the environment, such as allergen like smoking or perfume, etc. But also when the lungs overreact to signals inside the body, such as stress and anxiety. And what happens is this leads to bronchospasm. So remember those little bronchioles we talked about? They become very stiff, they become very swollen, and they become very narrow. And the lung then starts to fill up with mucus, it starts to fill up with fluid, and none of that gas exchange that happens at the alveoli can take place. So now carbon dioxide, which we know is toxic, builds up in the blood, and oxygen, which the body needs, goes way low. And because of that, the body slowly starts to suffocate. Because this whole airflow system is blocked, asthma can overlap with COPD or diseases that obstruct airflow, like we learned last time. Now, the symptoms of asthma are mostly wheezing, where you get that high-pitched sound because the air is trying to get through those narrow tubes, coughing, and then also feeling short of breath because there's just not enough oxygen in the body. The causes of asthma are many, but it can be genetic, meaning it can run in families. It can be caused by uncontrolled GERD, remember where the acid comes up the esophagus and drips into the trachea. It can be caused by anything that irritates the lungs, such as infections. And it can also be caused by certain medications that are really good for one part of the body, but maybe not so great for the other. So for example, there are a group of medications that are very good to help the heart work less hard after a heart attack, but then they don't let the lungs work hard enough. The way to prevent or treat this disease is to basically avoid anything that will be irritating the lungs to begin with. So avoiding the smoking, controlling that GERD, managing stress and anxiety a little bit differently, and staying away from people who are infected or getting infections in general. The medications for asthma nowadays are amazing. There are inhalers that you can put directly into the lung, there are pills, and there are even injections. The goal of these medications is to calm that swelling down, to relax those bronchioles, and some of them even prevent the reaction from happening in the first place. But probably the most important thing that asthmatic patients have to remember is to be prepared. Always keep that inhaler handy. Avoid any triggers and always keep track of what is going on around you so that you avoid the smoke, you avoid the pollutants, and you avoid sickness or illness. As Henri Descartes said, always mind your surroundings. Until next time.